I could feel something had arrived around my lungs. Though it was letting me breathe, I could breathe up to 80%. But after that, I couldn't breathe.
Hi guys, what's up and welcome to this week's video. So this week I will be interviewing a doctor who also happened to have coronavirus a couple of weeks ago. So it'll be really interesting to understand his experience and gain some insight into what it's like working as a doctor during this pandemic. Firstly, thank you very much for joining me today. What's your name and where do you work?
Yeah, my name is Irtaka Ali Hasnan and I work in Swansea Bay University Health Board in Department of General Medicine and Stroke.
So how does a workday during this pandemic differ from your normal hospital workday before the pandemic?
Yeah, because there are different departments, for example, psychiatry, dermatology, or some other departments, they are almost closed. Elective procedures, operations, they have been postponed or cancelled. Only emergency surgical procedures are being done. But general medicine, it's still the same, or you can see more patients.
Why did the other wards close?
First of all, they are related to mental health. They don't deal with emergencies. There's nothing like life-threatening situation for those patients. They have been closed down just as a precautionary measures in case we need more space for COVID-19 patients. And there have been 2 other wards which have been converted as COVID-19. There's social distancing when you go, though we can't maintain social distancing with our colleagues, with other doctors or healthcare professionals. It's very difficult. So the workload is almost the same. If we have some suspected COVID-19 patient or confirmed, we test him for COVID-19. If he is COVID-19, then we transfer him to COVID-19 ward. Everyone has been trained. Everybody is ready. So if we have to go and see any patient in COVID-19, we go there as well. Yeah.
And how often does that happen, that you have to go see a COVID-19 patient?
Once in a week, we definitely have to go. Lots of people in my hospital, they are going off sick. Lots of doctors, nurses. So when they go off sick, we have to cover them.
I believe you yourself got coronavirus a couple of weeks ago. So can you please describe your experience?
Last month in April, 6th of April, I got COVID-19 symptoms. I started having dry cough. And the same day I started having fever. So I realized that I got COVID-19 because lots of doctors, as I mentioned, they are getting these symptoms because of lack of PPE in the hospital. Next day I told my hospital, they booked in swab testing for me. Third, I was told that it's positive. So stay at home for at least 7 days. If you are living with someone, the other person has to quarantine for 14 days. As my wife was with me. So I told her that you have to quarantine for at least 14 days and we have to see whether you develop symptoms or not. I needed willpower to fight with it, but thankfully I recovered from it.
Did your wife also get it?
No, thank God she didn't develop any symptoms. I don't know why.
That's pretty amazing. Because most celebrities, for example, who get it, their partner immediately, the next day they've got it.
I hope so that she has very strong immunity system, that's why, and I hope she's immune to coronavirus by now. Yeah. But still we have to be very careful. Even for me, I'm not 100% sure whether I'm immune or not. Until I get my antibody testing. They haven't started doing antibody testing. Once they start doing it, it will be a game changer for the whole country. Because after that test, we'll get to know which patient is positive, which patient is healthy, and which patient had infection in the past and he's immune. So the people who are immune, will let them go out because they will help break the chain of spreading virus from one person to the other. And the people who are positive but asymptomatic will send them home.
So you said you developed a dry cough, and did you have any breathing problems or any other symptoms?
Yeah, after 4th day, I felt I have lost my sense of smell.
Oh, really?
Yes, and then next day, I lost my appetite. I developed shortness of breath on exertion. Like if I walk from even my bedroom to toilet, I could feel I'm out of breath. But I took lots of rest. I stayed most of the time in my bed, but symptoms got worse gradually. 10th day was the worst when my fever was more than 39 and it wasn't going down. I could feel little bit shortness of breath at rest as well, even in my bed. But I didn't lie on my back. I was like on my either right side or left side because our lungs are mostly at the back. So if we lie straight, there's more pressure on the lungs. Yeah, day 10 was very crucial actually for me. I contacted 111. They said, okay, you are better. If you get any worse, let us know, we'll take you to hospital. That's the time I got panicked because I knew if they take me, I don't know whether I will come back or not. And also in front of my wife, I had to act very strong that nothing is wrong. But deep inside, I was actually mentally prepared that it could get worse. 11th day, I started feeling better.
That's very good. I'm very glad you came out of it without needing to be hospitalized. Okay, so something that you touched upon earlier was PPE. So what is the current situation like with PPE in hospitals?
Current situation before I got COVID-19, it was very bad. We were not allowed to use surgical masks even. Surgical mask is nothing. It can only protect you from dust, nothing more than that. After I went back to hospital after recovery, yes, now we are getting surgical masks. We get some visor screen to protect our eyes, face. But that's not enough. Our ideal PP, like for example N95, FFP mask, there should be proper apron where my elbows should be covered, my whole body should be covered, not this usual stuff. But that's why we're catching from one person to other. Even last week, my colleague, one of my doctor colleague, he got sick. Where he got it from? Most likely from the hospital. Why he got it from the hospital? Because of inadequate PP.
Do you think you got the coronavirus from the hospital as well?
I got because one day there was shortage of doctor. So from the neighboring ward, a couple of colleagues came. They saw patients with me. Then we were sitting together. So after a couple of days, I came to know that all of them have gone off sick. All of them developed symptoms. I was actually sure that I might get symptoms after 4 or 5 days. And that's what happened.
Why do you think that the number of deaths in the UK is so high compared to other European countries?
There are many reasons, but still I can't be sure why it's so high. But multiple factors played their role. Number one, late lockdown, because government was waiting for herd immunity. So the lockdown was very late. The virus had spread to so many people, and it takes 14 days, to develop symptoms. So by that time, people develop symptoms, they had transmitted virus to other people. Number two, UK has elderly population. There's so many people over 80 years of age, even in my ward. There is not a single patient who is less than 65 years old. They have comorbid conditions. For example, they have diabetes, hypertension, heart problem, all those things. And if they catch virus, there are very less chance of survival. Number three, lack of testing. I was lucky that I got tested. I know a lot of my doctor friends in London, in other parts of England, they were not tested even. So if government did not start mass level testing during early stages, which was very important.
So we've seen those images of Italian hospitals previously, where in the hallways they have beds and lots of patients. Is that what it's like in UK hospitals currently?
No. As far as Wales is concerned, the situation is not like that. So we got sufficient number of beds.
Do you think it's headed that way? Do you think that's a possibility?
No.
Okay.
It's now the numbers are going down everywhere. Even in London, which was hit very hard by COVID-19, they built Nightingale Hospital in Excel, London. They are planning to close down now because there are no patients anymore.
Do you have any advice for the general public or people watching this video?
I would advise everyone to follow government guidelines. Social distancing, very important. If you can work from home, if you can stay home, do it. You have to live till September, October. Try to do that and try to build immunity. Or for anyone who survived, it's because of the immunity, because virus attacks you. And if you don't have any other medical condition, for example, any cancer, diabetes, any lung problem, asthma, any infections, if you don't have low immunity, then you can survive. If you have any of these conditions, then you get very few chances of living. So this COVID-19, many people say, oh, I might have got COVID-19 in the past. No, the feeling was very different. It was not like normal flu, normal fever. No. So just build your immunity. You can Google it. Use more vitamin C, eat healthy, exercise.
Okay, thank you very much for your time, and take care. And I hope to meet with you very soon when all of this is over.
Yeah, sure. And you also stay safe, stay home. Yeah, day 10 was very crucial actually for me.